Are you unknowingly ignoring your body's most critical alarm? Many men, especially as they age, dismiss subtle changes like frequent bathroom trips or minor discomforts, unaware these could be early signs of prostate cancer. It's easy to brush off a slight ache as just getting older, but medical professionals emphasize early detection dramatically improves outcomes. Don't let a common oversight cost you your future. We'll reveal 6 often missed signs. If you care about your health after 60, this is a video you'll want to watch till the end. As we reach our golden years, the dream is often to enjoy more time with loved ones, pursue hobbies, and live life to the fullest. However, certain health concerns become more prevalent, and one of these is prostate cancer. The prostate is a small gland vital for male reproductive health, located just below the bladder. As men age, especially past 60, the risk of prostate cancer significantly increases. It's one of the most common cancers among men, often growing slowly. The challenge is that its early signs can be subtle, easily dismissed as normal aging, or simply ignored due to discomfort or fear. This article, 6 Tanda Kanker Prostat Yang Sering Diabekan Priya, highlights these crucial indicators. For seniors, understanding these signs isn't about creating anxiety, but about empowerment. Early detection is key. Ignoring these signs can lead to the cancer progressing, potentially causing more severe symptoms like difficulty with urination, pain, fatigue, and even spread to other parts of the body. This can severely impact independence, social activities, travel plans, and overall well-being. Imagine having to constantly worry about bathroom access, or being too tired or in pain to enjoy your grandchildren. Taking proactive steps now can help preserve your vitality, dignity, and the ability to continue living the active, fulfilling life you deserve. Alright, let's dive into our first crucial point, an increased need to urinate, particularly at night, a symptom often known as nocturia. Many men dismiss this as a normal part of aging, a consequence of drinking too much water before bed, or simply a sign of a benign, enlarged prostate. However, while these can certainly be contributing factors, persistent and worsening frequent urination, especially when it disrupts your sleep multiple times a night, can be an early indicator that something more serious, like prostate cancer, might be at play. The prostate gland is located just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When a tumor begins to grow within the prostate, it can exert pressure on the urethra, narrowing the passage. This obstruction makes it harder for the bladder to empty completely. As a result, the bladder might feel full more often, leading to a constant or more frequent urge to urinate, even if only small amounts are passed. This irritation and incomplete emptying are often amplified at night because when you lie down, fluid can shift more easily, and the kidneys produce more urine, making the bladder more sensitive to any internal pressure or obstruction. What distinguishes this from other common causes like benign prostatic hyperplasia, BPH, which also causes urinary frequency, is the nature of the change. While BPH typically involves a gradual, symmetrical enlargement of the prostate, a cancerous tumor might cause a more localized or rapid obstruction, or irritate specific nerves that trigger the urge to urinate. It's not just about how often you go, but also the feeling of urgency, the strength of your stream, and whether you feel your bladder is truly empty afterward. Ignoring this symptom, attributing it solely to age or benign conditions, means missing a critical window for early detection. Prostate cancer caught in its early stages is significantly more treatable, often with excellent outcomes. By the time urinary symptoms become severe and undeniable, the cancer may have progressed further, making treatment more complex. Therefore, any noticeable and sustained change in your urinary habits, particularly if it involves waking up multiple times during the night, warrants a conversation with your doctor to rule out malignancy and ensure appropriate management. Have you experienced this? Share in the comments. Moving on from the often discussed urinary symptoms, which can be early indicators, our second crucial sign focuses on a different type of discomfort that many men unfortunately dismiss as normal aging or everyday aches: persistent pain in the lower back, hips, or thighs. This isn't just a minor, fleeting ache that comes and goes. It's typically a persistent, unexplained discomfort that doesn't improve with rest, over-the-counter pain relievers, or common remedies for muscle strains. The reason for this specific pattern of pain is highly significant and often points to a more advanced stage of prostate cancer. Prostate cancer has a notorious tendency to metastasize or spread to the bones, particularly those in the axial skeleton like the spine, lower back, pelvis, hips, and the upper parts of the femurs, thighs. When cancer cells infiltrate bone tissue, they can disrupt its normal structure, leading to inflammation, bone weakening, and direct irritation of nerve endings, all of which manifest as pain. This isn't necessarily an acute, sharp pain like a sudden injury. It can often be a dull, deep ache that gradually intensifies over weeks or months. It might be worse at night, or it might not be relieved by changes in position, unlike many musculoskeletal pains. One of the primary reasons this symptom is so frequently overlooked is that men commonly attribute such pains to benign conditions. They might dismiss it as a consequence of aging, a flare-up of arthritis, a pulled muscle from physical activity, or simply general wear and tear on the body. Many men have pre-existing conditions like chronic back pain or hip issues, which makes it even easier to misinterpret a new, more sinister pain as just an exacerbation of an old problem. This complacency is dangerous because, by the time bone pain becomes a noticeable and persistent symptom, it often indicates that the cancer has progressed beyond the prostate gland, making treatment more complex and challenging. Ignoring this warning sign can have severe consequences. Left untreated, metastatic bone lesions can lead to pathological fractures, where bones break easily under minimal stress due to being weakened by the cancer. More critically, if the cancer spreads to the vertebrae in the spine, it can cause spinal cord compression, a medical emergency that can result in neurological deficits such as numbness, weakness, or even paralysis in the legs. Therefore, any new, persistent, and unexplained pain in your lower back, hips, or thighs, especially if it's not clearly linked to a specific injury or strenuous activity, should prompt an immediate consultation with a healthcare professional. It is a critical warning sign that should never be rationalized away as merely a part of getting older. Have you experienced this? Share in the comments. Next, we delve into a symptom that many men might dismiss as a natural part of aging or everyday aches: persistent pain or stiffness in the lower back, hips, or thighs. While back pain is incredibly common and often benign, when it becomes a persistent, unexplained ache in these specific areas, it can be a red flag for prostate cancer, particularly if the disease has advanced. Men frequently attribute such discomfort to muscle strain, arthritis, an old injury, or simply a bad back. They might try over-the-counter pain relievers, rest, or even ignore it, hoping it will resolve on its own. However, if prostate cancer has spread beyond the prostate gland, it commonly metastasizes to the bones, especially those in the pelvis, lower spine, and upper leg femur. When cancer cells establish themselves in these bones, they can cause significant pain, tenderness, and stiffness. This pain is typically described as a dull, constant ache rather than a sharp, acute pain. It may worsen at night or with activity, and unlike typical muscular pain, it often doesn't respond well to conventional remedies like stretching or heat packs, or it returns persistently. The stiffness might be more pronounced in the mornings or after periods of inactivity. It's crucial to understand that this isn't just any backache. It's a specific type of pain linked to bone involvement. The presence of these bone metastases indicates a more advanced stage of prostate cancer, making early recognition even more vital for effective management and treatment planning. Ignoring this symptom can lead to delays in diagnosis and treatment, potentially impacting outcomes. Therefore, any new, persistent, or unexplained pain in these regions, especially if you have other risk factors for prostate cancer, like age or family history, warrants immediate medical evaluation rather than simply attributing it to the usual wear and tear of life. Have you experienced this? Share in the comments. Next, let's discuss a symptom that many men might dismiss as a natural part of aging or stress, but which can sometimes be a subtle indicator of prostate cancer: erectile dysfunction, or ED. This condition, characterized by difficulty achieving or maintaining an erection firm enough for satisfactory sexual activity, is remarkably common. Indeed, its prevalence often leads men to attribute it to a myriad of benign factors such as increasing age, psychological stress, fatigue, or other chronic health conditions like diabetes, heart disease, or high blood pressure. This widespread assumption that ED is merely an inevitable consequence of getting older or a sign of general poor health is precisely why it frequently goes uninvestigated as a potential symptom of something more serious, like prostate cancer. However, when ED arises due to prostate cancer, its origin is often quite distinct from these more common causes. The prostate gland is intricately positioned within the male pelvis, surrounded by critical structures, most notably the neurovascular bundles. These delicate bundles, located on either side of the prostate, contain the nerves and blood vessels that are absolutely essential for the physiological process of an erection. They transmit the necessary signals from the brain and facilitate the blood flow into the penis required for firmness. As a prostate cancer tumor grows, particularly if it expands beyond the prostate capsule or invades nearby tissues, it can directly impinge upon, compress, or even damage these vital neurovascular bundles. This physical interference disrupts the intricate neural pathways and vascular supply, leading to impaired erectile function. The onset might be gradual, perhaps starting as a decrease in the rigidity or consistency of erections, or a longer time needed to achieve them. As the cancer progresses and the pressure or damage to these bundles increases, the ED can become more pronounced and persistent. It is crucial to differentiate this from ED that might arise as a side effect of prostate cancer treatments, such as radical prostatectomy or radiation therapy, which are well known to impact erectile function. Here, we are focusing on ED as a potential pre-diagnosis symptom of the cancer itself. The insidious nature of prostate cancer means its symptoms can develop slowly, and a man might simply adjust to a gradual decline in sexual function, inadvertently overlooking a critical warning sign. Therefore, new onset or progressively worsening ED, especially when it cannot be readily explained by other common factors or if it accompanies other subtle urinary changes, warrants a thorough medical evaluation. Openly discussing changes in sexual health with a doctor is a vital step in early detection, enabling timely intervention and potentially improving outcomes. Ignoring this symptom can have significant consequences for both quality of life and the progression of the disease. Have you experienced this? Share in the comments. Next, let's discuss a symptom that is frequently overlooked because it can easily be attributed to common age-related issues or general wear and tear: persistent pain or stiffness in the lower back, hips, or thighs. While back pain is incredibly common among men, especially as they age, and can result from numerous benign causes like muscle strain, arthritis, or disc problems, when it's a symptom of prostate cancer, it carries a very different and more serious implication. The primary reason prostate cancer can cause pain in these areas is due to metastasis, meaning the cancer has spread from the prostate gland to other parts of the body. The bones, particularly those in the spine, pelvis, hips, and upper leg bones, thighs, are common sites for prostate cancer to metastasize. When cancer cells invade bone, they can disrupt the normal bone structure, leading to either bone destruction, osteolytic lesions, or excessive new bone formation, osteoblastic lesions. Both processes can cause significant pain. The presence of cancer cells can also trigger an inflammatory response and put pressure on surrounding nerves, further intensifying the discomfort. Unlike typical muscle aches or strains that might resolve with rest or over-the-counter pain relievers, pain from metastatic prostate cancer tends to be persistent, often dull and aching, though it can also be sharp. It may worsen over time and can be particularly troublesome at night, sometimes even waking a man from sleep. This pain is not usually relieved by changes in position or typical remedies for musculoskeletal issues. Stiffness, especially in the mornings, can also accompany this pain, mimicking symptoms of arthritis. It's crucial for men and their doctors to consider prostate cancer as a potential cause when such pain is unexplained, progressive, and not responding to conventional treatments for benign conditions. Recognizing this symptom is vital because it often indicates that the cancer has advanced beyond the prostate gland, potentially making treatment more challenging. Therefore, any new, persistent, or worsening pain in these areas, especially if not linked to a specific injury or activity, warrants a thorough medical investigation to rule out serious underlying causes like prostate cancer. Have you experienced persistent, unexplained pain in your lower back, hips, or thighs? Share your thoughts and experiences in the comments below. Next, let's discuss a symptom that is frequently overlooked because it can easily be attributed to common age-related issues or general wear and tear: persistent pain or stiffness in the lower back, hips, or thighs. While back pain is incredibly common among men, especially as they age, and can result from numerous benign causes like muscle strain, arthritis, or disc problems, when it's a symptom of prostate cancer, it carries a very different and more serious implication. The primary reason prostate cancer can cause pain in these areas is due to metastasis, meaning the cancer has spread from the prostate gland to other parts of the body. The bones, particularly those in the spine, pelvis, hips, and upper leg bones, thighs, are common sites for prostate cancer to metastasize. When cancer cells invade bone, they can disrupt the normal bone structure, leading to either bone destruction, osteolytic lesions, or excessive new bone formation, osteoblastic lesions. Both processes can cause significant pain. The presence of cancer cells can also trigger an inflammatory response and put pressure on surrounding nerves, further intensifying the discomfort. Unlike typical muscle aches or strains that might resolve with rest or over-the-counter pain relievers, pain from metastatic prostate cancer tends to be persistent, often dull and aching, though it can also be sharp. It may worsen over time and can be particularly troublesome at night, sometimes even waking a man from sleep. This pain is not usually relieved by changes in position or typical remedies for musculoskeletal issues. Stiffness, especially in the mornings, can also accompany this pain, mimicking symptoms of arthritis. It's crucial for men and their doctors to consider prostate cancer as a potential cause when such pain is unexplained, progressive, and not responding to conventional treatments for benign conditions. Recognizing this symptom is vital because it often indicates that the cancer has advanced beyond the prostate gland, potentially making treatment more challenging. Therefore, any new, persistent, or worsening pain in these areas, especially if not linked to a specific injury or activity, warrants a thorough medical investigation to rule out serious underlying causes like prostate cancer. Have you experienced persistent, unexplained pain in your lower back, hips, or thighs? Share your thoughts and experiences in the comments below. Moving on to our final crucial sign, one that is frequently dismissed yet holds significant implications: persistent pain in the back, hips, or pelvis. This isn't just your everyday muscle soreness or an occasional stiff back from sleeping wrong. We're talking about a persistent, nagging ache or stiffness, particularly in the lower back, hips, thighs, or pelvic area, that doesn't resolve with rest or typical remedies. This type of pain is a significant red flag because it often indicates that prostate cancer, if present, has advanced and potentially spread beyond the prostate gland itself. The most common site for prostate cancer metastasis is the bones, particularly the spine, pelvis, and ribs. When cancer cells establish themselves in these bone structures, they can cause localized inflammation, bone destruction, or new bone formation, leading to significant discomfort and pain. The danger lies in why this symptom is so often ignored. Men, especially as they age, commonly experience various aches and pains attributed to aging, arthritis, physical activity, or minor injuries. It's incredibly easy to dismiss persistent back or hip pain as just getting old or a pulled muscle. Many might self-medicate with over-the-counter pain relievers, assuming the discomfort will eventually subside. There's often a profound lack of awareness linking such generalized musculoskeletal pain directly to prostate health, leading to a critical delay in seeking medical evaluation. The pain might also be intermittent at first, further contributing to its dismissal as benign. By the time this type of pain becomes pronounced and undeniable, the cancer has likely progressed to an advanced stage. This significantly narrows treatment options, shifting the focus from curative approaches to managing the disease and alleviating symptoms. Delayed diagnosis of metastatic prostate cancer can lead to more severe complications, including pathological fractures, bones breaking easily, spinal cord compression, leading to weakness, numbness, or paralysis, and severe, debilitating pain that drastically impacts quality of life. Recognizing this symptom early, even if vague, can prompt investigations that lead to an earlier diagnosis of advanced disease, allowing for more timely and potentially more effective interventions to control the cancer's spread and manage symptoms. It underscores the importance of not just observing changes in urinary habits, but also paying close attention to any persistent, unexplained body pains that deviate from your normal. Have you experienced this? Share in the comments. Here are 6 practical, safe, and moderate health tips related to prostate health awareness. 1. Prioritize regular health checkups. Regular visits with your doctor can help monitor your overall well-being and provide opportunities to discuss any health changes you might notice. 2. Be attentive to your body's signals. Noticing any changes in your usual bodily functions, especially those related to urination or pelvic comfort, is a good practice for self-awareness. 3. Have open conversations with your healthcare provider. Feel comfortable discussing any new or persistent urinary, sexual, or pelvic symptoms you might experience with your doctor. 4. Embrace a balanced lifestyle. Incorporating a nutritious diet, regular physical activity, and maintaining a healthy weight can contribute positively to your general health, including prostate well-being. 5. Understand your family health history. Being aware of any history of prostate cancer or other related conditions in your family can be valuable information to share with your doctor. 6. Seek timely professional advice for concerns. If you experience any persistent or worrying symptoms, it's always advisable to consult with a healthcare professional without delay. As our time together comes to a close, please know that your presence here truly warms our hearts. If this video resonated with you, please take a moment to hit that like button, share it with someone who might need to hear this message, and subscribe to join our growing family. Most importantly, we'd be truly honored if you shared your own beautiful experiences in the comments below. Your unique stories enrich us all. And to our incredible seniors in the audience, remember, your journey is a masterpiece still being painted. Every day is an opportunity for new joy, new learning, and new adventures. Keep shining your light, for your wisdom and spirit inspire us all.